Ladies and gentlemen, boys and girls, if you're just joining us, this is KUTV Rise Today, and this one here is the WCW edition, Woman Crush Wednesday. However, as much as you expect that I'm only celebrating women, which I will do later on in the show, one thing I do very importantly in the show is to make sure that you guys are aware, sensitized, and protected. Because when you have the knowledge, you know what to do with yourself, you know when to go in for your checkups, and you know how to beat COVID-19 when you know how to beat any other underlying issues. So we do not know yet if you're suffering it or not, but I do know that my doctors on set, as I had already introduced them, are here to shed more light and create more awareness on TB. Join us in the conversation. That is KUTV_Kenya on Twitter. You will find something going on there. Talk to us about it. You will also see this show live on Facebook. So join the link, leave a comment. KUTV Kenya is the page on Facebook. That is on Matters TB. Ask your questions. The doctors are here and willing to answer, all right? Also, on age consent, we'll talk about that in a bit, but for now, let's just shift to health matters. And doctors, welcome very much for coming. You know, I'll say doctors. I don't know if someone has used that word before, but Dr. Gabriel and Dr. Penina, it's really good to have you. So I know I'm going to ask you to introduce yourselves again to my viewers, starting from Penina here, and tell us exactly what you do, because you coordinate quite a number of things in the metropolitan area. So you want to tell us more about yourself.
Thank you.
Yeah.
My name is Penina Makena Michuki. I'm a clinician working for Nairobi Metropolitan Services.
Please, you, excuse me, you might need to use your microphone a little closer. All right, thank you.
Thank you so much.
Yeah.
My name is Makena Penina Michuki. I am a clinician working for Nairobi Metropolitan Services, currently coordinating TB, leprosy, and lung diseases in Roysambu sub-county. Yes.
Nice. We'll get to know more about how that goes.
Thank you.
And Dr. Gabriel?
Thank you, Dorice. My name is Dr. Gabriel Wari. I am in charge of health services in Kenyatta University. That includes student health and staff health. Yeah, thank you for having me in the show.
It's good to have you. It's good to have you both. And usually I like to say this because it's a gender zone. I know it's not very important to say this, but it is good to have both of you on set, because people say, you know, doctors back then were all men. Like, men understand these things. Men are less emotional. It's good to have you here as well. So tuberculosis, TB. Yes. I know the world is all crazy about COVID-19 right now, but there are certain issues that we cannot avoid, we cannot ignore. Everyone now is going for COVID-19 tests, and a lot of people are ignoring other issues like TB, for example. So first, I'm just going to ask Daktari. There is evidence, I believe, that Nairobi now is becoming a hotspot for tuberculosis. I do not know how accurate this is, and if you want to just shed more light on that as we delve deeper.
Yeah, indeed, that is true. Nairobi, because of many factors, is a typical place where you would expect quite a high number of TB cases. And this is because TB is driven mainly by close contact. So you can imagine in Nairobi, because of the high population, there is a lot of crowding, and therefore any kind of respiratory disease that is spread by droplets or that is airborne can actually spread faster. I know Makena, actually being the TB coordinator, has actually some statistics that might help us now paint the picture.
Yeah, so Makena, just give us the statistics just so that we get the clear picture, so the viewer really understands why this is very, very important.
Oh, thank you. Actually, Nairobi has been a hotspot for TB since time immemorial because of overcrowding, like Dr. said. We also host a number of informal settlements. And so this one predisposes a lot of population to tuberculosis. So we've always been an hotspot. Like I said earlier, COVID-19 has really affected our TB cases and quality of care also. And like in comparing 2019 and 2020, our cases really dropped in 2020. In 2019, we registered about 8,600 cases of TB, the normal TB. But in 2020, we registered like 76,000 cases. So we lost like 10,000 cases. For Nairobi County, this is statistics for national. In Nairobi County, we registered like 12,200 cases in 2019, In 2020, we registered like 9,000 cases. So we lost again like 3,000 cases. So some of the reasons why we lost our cases is because, consumption for healthcare services was very low in 2020. Okay. If anybody was having a cough, everybody was suspecting that you could be having COVID-19. So people shied away from consuming our services. So that is one of the reasons why the TB cases went down. Also, quality of care went low. Our outcomes really went down because, people self-transferred. Like Kenyatta University closed down abruptly, and students just went home. They didn't know where to link up with the TB services. So that also affected our outcomes for TB. Some patients died. Others also, defaulted treatment. Yes.
That's very, very serious. What we're hearing right now is we have cases, but some people are not even coming out to get tested for it. Now, I'm just curious. Yes. I don't know which one of you is going to answer this question just in that area, because it is a follow-up question. Yes. I'm wondering, because people are not coming out now to, test for TB. When people go out testing for COVID-19, at any point are they tested for any other, TB, for example, or it's just COVID? And when you're negative for COVID, just go home, and you don't even know if you're going to be seeing symptoms for TB. Dr.
Yeah, I think we have gone through a phase, and especially for healthcare workers, anything respiratory, I think for the past 12 months has been COVID. But progressively, I think there's an awareness, and that's why actually we are here, and even Penina was very keen on coming for this interview, is that we are realizing that not every cough is actually COVID. The old diseases that we've always been having, like TB, like what she's mentioned, the issue of that we are not, the prevalence of TB has gone down. That is partially because of the measures that we have put, because now we are wearing masks, we are social distancing, so that's positive. But on the negative is that nobody is testing, the focus on testing for TB and actually actively seeking it out has gone down. But I'm happy, I think for clinicians, and she can attest, is that we are now going back to do the COVID test, yes, but then TB is always there. So you also need to take another sputum. Now there is also the challenge that you see for COVID test, it's actually something for the nasal swab. And then now for TB, you actually need a sputum sample, predominantly.
So there's a difference. I know somebody was trying to also get, so what's the difference? I think when they find out this, they know that. So when you want to talk about the symptoms, because of course when people go online, they try to Google all these symptoms, but Google can drive you crazy sometimes. Yes. So if you have you in studio, it's good to just give us really what are these symptoms of TB? How then do I know that before I rush to the hospital and say I need a test for COVID? Yes. These are the symptoms for TB.
So thank you so much. So we are going to talk about differences between TB symptoms and COVID symptoms, because actually we have a lot of symptoms that are almost alike, but we are now talking about the 4 cardinal signs for TB. And when talking about the 4 cardinal signs for TB in adults, we are talking about cough of any duration. It's not cough of 2 weeks like people used to say, because TB today is TB after 1 month or 2 years, isn't it? So we are talking about cough of any duration, fever, and this fever is intermittent fever. It is on and off. Today it is there, tomorrow it is not there. That is TB fever. We also have a weight loss, and this is unintentional weight loss. It is not weight loss that you have planned to have. It is an intentional weight loss. And actually, as a clinician, you're able to tell that this person has lost weight, even without him or her telling you. Then we also have a night sweat. This night sweat is a night sweat where you sweat until you have to wake up in the middle of the night and change your pajamas or your night dress or your beddings. So it is a drenching night sweat. So those are the 4 cardinal signs for tuberculosis. When it comes to pediatrics or children, it's very difficult to really get a diagnosis for a pediatric, but they present with reduced playfulness. Like any child who is not playing, all of us know our children very well. If you come back at home in the evening and find out that your child is not playing like usual, is not behaving usually, this is a sick child. So this is a child that you evaluate for TB diagnosis. You also have a child who is not adding weight or has a stunted weight or a constant weight. That is why we always insist when a parent is bringing a child to a hospital, carry the clinic card so that you're able to get to know about the weight of the child. Yes.
All right. Okay. Now those are the symptoms of TB.
Yes.
So now they can look at that against the
Yes.
COVID-19 symptoms.
Yes.
All right. Now you are in charge of Roysambu.
Yes.
And I'm very, very curious now because we'll get more accurate information from
True.
you. How is the prevalence in Roysambu of TB actually?
Yes. Comparing 2019 and 2020 again, like everywhere else, we also got affected very, very much. Actually, in 2019, we were registering like 180 cases. Now we are registering less than 100 cases per quarter. This is per quarter. When you're talking about a quarter, we are talking about 3 months. Every year for TB, we count from January to March as first quarter, going on to all the way to December. So every quarter in 2020 we really got affected. We were registering like less than 100 cases against what we used to register back in 2019 and backwards. Yeah, so we really got very affected. But the services are coming back again. People are coming back to the facilities again. So we are catching up. Like this year, we are like 3 months into 2021, and we are really seeing results. Like for pediatric case finding, children case finding, we are at 9%. The whole of 2020, we were at 4%. You can imagine now we are at 9%. I know we are really going to do a lot by the end of the year because services are back again, and patients are seeking healthcare services again in the facilities.
I think that's really, really positive. Dr. That is what is going on, with Roysambu. But now let's come back to Kenyatta University. Kenyatta University is one of those very highly populated universities, except for now with the COVID-19, we have not a lot of people coming in, but how has it been? How is the prevalence right now? Because we're trying to create awareness. What is the situation like in Kenyatta University in terms of TB prevalence?
Yeah, thank you, Doris. Indeed, we have been having quite a vibrant TB program prior to last year when the COVID issue started. Because we had resident students. Now with students having this blended learning, and actually with the eventual cessation of face-to-face learning, we are actually having the students moving out of campus. But I would say on average, I think we had about a combined number of patients in care at our clinic were about 120. So that's combined staff and students. That's a combined population. Of course, we have had a tough task of trying to link them to their home facilities. And if there are those that are around Kenyatta University and can access the facility, then they are actually very welcome and they are continuing with care. But the issue of linkage, especially with the abrupt closure last year, was quite detrimental. But so far we have recovered, and I'm happy actually because of the changes that the university has done in terms of trying to improve the respiratory health overall for COVID, and also the same benefits will also translate to TB. But still, what I would want to say, we have been running a campaign, and I think McKenna will bring it up later, where we have a short code. And we have actually been encouraging the healthcare workers to actually screen for these symptoms that have been said. You have a cough of any duration, fever, night sweats, and weight loss. If a patient, even coming with stomach aches, presents with those symptoms, then the clinician should actually ask for a TB test. But further to that, we wanted also to engage on the patient side, so that when you have these symptoms, you actually, if the doctor does not ask, because the typical thing will just treat it as a normal cold or a normal respiratory infection. So what we've been trying is actually to create a demand from the staff and the student, so that they actually demand, can I do a TB test?
Oh, nice.
So we have a short code. It's let me just mention it.
You can mention it, and then we can talk about the treatment. And
So it's a short code. It's *371#. If it's free, it's virtually free, I think.
It's a free USSD code. Where you dial *371# and self-screen. It's a self-screening tool. Even you, we can as well screen ourselves.
Please, use your microphone closer.
Yes.
All right.
So you can do a self-screening for TB by dialing a *371#, even as right now. And when you dial this number, it will direct you to the nearest health facility where you can consume our services for free.
Nice.
All the TB services, from screening to testing to diagnosis and treatment, everything is free. And it is upon you to choose which facility you want across Nairobi.
I like that.
Yes.
I was
So,
actually going to ask that question.
Yes. We also have a toll-free call center where we have healthcare workers who are working 24 hours. They are able to attend to all the questions that anyone could be having about TB. If you have any symptom for TB, you can call. If you're taking TB medications and you have issues, side effects, you can call that call center for free. It is toll-free, and your issues will be addressed. The number is, you call 0800 72206. And we also, some of the strategies that we established during the COVID era, a free, a free medication also across board. Okay. We even decentralized services to even up to level 1. Level 1 is community level, where we are doing what we call differentiated care. Those patients that are so sick, they are not able to come to our health facilities. There are healthcare workers that would go to their homes, to their household level, and give them medications every day. That is happening with us.
Every day, you say?
Every day,
okay.
Every morning, if you're taking your medications in the morning or in the evening. So we have healthcare workers on board who are going to a household level and give our patients who are very sick treatment every day. We also have a child-friendly medication, orange flavor actually, very, very nice for our children. So they are able to tolerate medications very well, and actually pediatrics or children respond so well with TB medications, better than adults. We also, we also have a free sample referral system, because like now here in Kenyatta University, we have, the normal testing mechanisms, but we have the most recent, techniques like the one we call Gene Expert, the most preferred, highly sensitive, highly specific. So for that one, we don't have it here, but we usually have a free sample referral network where they collect samples from their laboratory, and then there's a system where this sample is transported to our Gene Expert site. So that one has also enhanced our TB services. We've also done a lot of capacity building for our healthcare workers.
Nice. Okay.
In 2020, we were not able to do a lot of physical trainings, but actually we did a lot of virtual trainings, and we came to realize that there's a lot we can do with virtual platforms. Yes.
Oh my, I think that is so detailed. And I understand now why Dr. Gabriel said she will give you the details, including the free treatment and having somebody come in daily to take care of you. I think that is really a step that has been taken here. Remember the codes that have been given. Just once again, I think I'll ask Dr. Gabriel, or should I ask her again to repeat them? Yeah, please repeat the code, the one that you dial, the star, and then also the one that
the call center,
the free,
yes.
The free call
so you can do a self-screening for TB where you dial *371#, and you get that there are particular questions, the 4 cardinal signs that you get to be asked, and if you have one of those symptoms, they will direct you to a health facility where you consume our services for free, from screening to diagnosis and to treatment.
So that is
*371#, *371#. That is self-screening. Yes, that is self-screening. We also have a call center, a toll-free call center where we have healthcare workers working 24 hours. You can also call them if you have issues with TB. You have a symptom, you're not sure if it is COVID, it is TB, it is pneumonia, it is asthma. You can call and you'll be advised. And the number is 0800 7220006. Sorry.
You can say that again so that we can hear.
0800 7220006.
There we have it. Now, ladies and gentlemen, boys and girls, if you are dealing with TB, I know that all the questions you wanted to even ask this morning have been answered through those particular numbers that you can dial and you can call. Just be the Kenyan who is responsible, be the human being who is responsible and courageous and brave enough. Dr. Gabriel, I know the people who do not come out for tests because they are scared. They fear of the unknown. So they'd rather, come on, iliandikwa, so Dr. Gabriel, what would you want to say, lastly on this particular, awareness that we're trying to create this morning? I'll just give you a minute or so to say something.
Yeah, thank you, Doris. I think my comments are that to the public out there, health is your responsibility. You actually need to take responsibility, take charge of your health. There are various strategies that have been put in place to avoid the social stigma, so that you can actually screen yourself. What I would want to say that TB is or tuberculosis is curable fast. I think that's a very important point that we need to make.
Yeah.
This is a curable disease. And in fact, compared to COVID, which has a very quick progression, TB actually you actually take the medicine and you actually get cured. And the best of all, the medicine is free in any public facility. So I would want to urge Kenyans out there, go for that TB test and get treated if positive.
I like
Thank
that.
you.
I like that. So go out there and do not worry about, oh, that's so expensive. You have heard, and we have reiterated, it is free. Your final words, Penina.
Probably I can tell the public about TB and COVID differences very fast, because some of us are really confusing between
that
TB
would be
and
very,
COVID.
very important
Yes.
as well.
So the onset for TB is quite a bit chronic compared to COVID. COVID is so acute. It's very acute, happening so rapidly. For cough in TB, it is a productive cough. You can have you produce sputum. You can also have a blunt stained sputum. For COVID, it is usually dry. It can also be productive if there is a secondary bacterial infection. So we also have fever in both diseases. For TB, the fever is intermittent. It is there today, tomorrow it is not there. For COVID, it is, spiking fevers of 38.5 and above. For difficulties in breathing, it is there in both diseases. But for TB, it comes at a later stage. So if you see a patient with TB who has difficulties in breathing, this is a person who is coming at a very later stage. For COVID, it is quite early. It sets up actually even between 0 to 5 days. So those are a few differences between COVID and TB.
Yeah,
Yes.
and I like that you have both closed in a very medical way. Of course, giving hope by Dr. saying it's positive. If you're positive, you can get the cure. It's not like we're managing you, we're actually curing you. Thank you so much, Dr. Gabriel Wari, Director Kenyatta University Health Services, Dr. Penina McKenna, who's the Roysambu Sub-County TB, Leprosy and Lung Coordinator, for being here and creating awareness on TB. I hope that now Kenyans, of course they always say economy in Mbaya, but now you have already told them, just make the move, because your health is your greatest wealth.
True.
Have a lovely, lovely day.
Thank
Thanks
you.
for coming.
Thank you very much.
Thank you
for
so
having
much.
us.
No, that's it for the TB awareness, guys. I hope that now you're in the know. Please do what you have to do and just kill that